A proposal to close a public pool in Oceanside is creating controversy. City leaders are considering shutting down the Brook Street pool to save money. But there's pushback from residents and community leaders who say the move seems racist. The Brook Street pool in Oceanside is open year-round. And while it wasn't busy today, it's a different story in the summer.
We take walking field trips there every summer, and over 500 kids are able to be impacted by going to that pool, learning water safety, learning how to swim, practicing how to swim, and having fun.
Jody Diamond, CEO of the Oceanside Boys and Girls Clubs, says a recent proposal to close the pool in order to save money would negatively impact communities of color.
What they are proposing to close the Brook Street pool is nothing short of institutional racism. Whether it's intentional or unintentional, the effect is still the same.
The City Council has requested a report from staff about how much money would be saved by closing Brook Street and could consider putting that money towards operating the new El Corazon Aquatic Center, which is miles away from Brook Street in a more affluent neighborhood. At a Parks and Rec Commission meeting earlier this week, city staff reportedly said there was money in the budget to operate both, giving hope to those who've signed this Change.org petition and the Boys and Girls Clubs.
I'm very hopeful. I'm hopeful that they're going to hear the voices. This is a vital resource to these children, and especially children of color.
Now, the Oceanside City Council is scheduled to discuss the Brook Street pool issue at next Wednesday's meeting.
Family members and co-workers are grieving the loss of a CBP officer who died from COVID-19.
Disbelief, and it's definitely surreal.
What they want everyone to know about it, and why the White House is pushing back the timeline for when children can receive the COVID-19 vaccine.
ABC 10 News at 5 starts now.
Well, the Biden administration is diving headfirst into the global effort to vaccinate people in poorer communities. ABC's Karen Travers reports it's something public health experts say has to happen to end this pandemic.
In his first major international address, President Biden again signaling a shift from his predecessor.
And I'm sending a clear message to the world. America is back.
Underscoring that message, the president announcing today the U.S. will contribute over the next few weeks $2 billion to the UN-backed program working to distribute COVID-19 vaccines to the poorest countries around the world. Another $2 billion will go out over the next year. Former President Trump refused to lend U.S. support to that global effort, even cutting ties with the World Health Organization. But that $4 billion was included in the $900 billion COVID-19 relief bill Trump signed in late December. The Biden administration says this massive contribution does not impact in any way the vaccine supply available for Americans. The U.S. has purchased 600 million COVID-19 vaccine doses, and the White House says it doesn't intend to give any to other countries until there's sufficient supply here. The U.S. is grappling with meeting demand for vaccines, but the situation in poorer nations is much worse.
So we really have to make sure that we get this vaccine around the world and not just to resource-rich countries.
The United Nations says as of now, 10 countries have administered 75% of all COVID-19 vaccine doses. More than 130 countries have not yet received a single dose.
Whenever there's transmission and viral outbreaks throughout the world, the United States will always be in danger, no matter what we do.
Unlike the United States, China and Russia have donated to developing countries vaccine doses from their own homegrown stockpiles, something that's being called vaccine diplomacy. Karen Travers, ABC News, Washington.
Starting next month, thousands of COVID-19 vaccines will be set aside specifically for the state's teachers and school staff. It's part of the governor's plan to safely reopen schools. ABC 10 News reporter Rena Nakano spoke to the president of the local teachers union, who says she's encouraged by the update.
California educators, school support staff, and child care workers will soon get priority COVID-19 vaccinations.
We are also setting aside 10% of all first doses, beginning with a baseline of 75,000 doses every single week for those educators and childcare workers that are supporting our efforts to get our kids back into in-person instruction. That's effective March 1st.
That's what our educators are waiting for and will be eager to get.
Keisha Borden is the president of the San Diego Education Association. She believes this is a great first step. The governor's announcement comes the day after state legislators reintroduced SB 86, a $6.6 billion plan to reopen schools once the local COVID infection cases goes into the red tier, or 7 per 100,000 residents, with a target reopening date in mid-April. Superintendents of 6 of the state's largest urban school districts, including San Diego, praised the bill. So did the local teachers union.
We agree with the legislature's guidance that a lower rate of community spread and cases at the red tier is a key component.
But the governor openly criticized the bill. He believes schools can safely reopen while still in the purple tier.
Our stipulation